Hello, I am Dr. Richard Melcrite from the Connecticut Department of Public Health's Infectious Diseases section. This is a briefing on the basics about Ebola. I'm giving this talk on November 13th, 2014, and the information is current on that date. What is Ebola? Ebola is a very serious disease caused by a virus. Most of the time it is rare. It isn't seen much at all, and outbreaks are small, and when they do occur, it is usually in remote areas of the countryside in Central Africa, a huge continent. The Ebola virus outbreak going on right now is big. It is found in 3 countries in West Africa: Liberia, Sierra Leone, and Guinea. It is found in the cities and the countryside of those countries. How is Ebola transmitted? How is it passed from person to person? Ebola is spread from person to person by touching the broken skin, mucous membranes, or blood or other body fluids of a person sick with Ebola. By other body fluids, I mean urine, saliva, sweat, feces or diarrhea, vomit, breast milk, and semen. Mucous membranes are the inside of the mouth, nose, and eyes. Objects like needles and syringes that have been contaminated with the virus can also pass the virus if they inject the blood or body fluid into the body of another person, such as through a needle stick, or if they allow the virus to get on the mucous membranes of another person. How is Ebola not transmitted? Infected people cannot spread the disease until they get sick. That's very important. I'll say it again. Infected people cannot spread the disease until they get sick. Ebola is not spread through the air or by water or by food. Mosquitoes or other insects don't spread Ebola. It is unlikely that cats or dogs can get Ebola, but we don't know for sure. That is why the dog of the nurse in Dallas was quarantined, kept separate from others, for 21 days. Who is at risk for Ebola? A person at risk is someone who contacts the blood or body fluids of someone with Ebola. Most of these people will be doctors or nurses treating Ebola patients, people who prepare bodies of victims of Ebola for burial, and persons who have lived with someone sick with Ebola. The risk can be reduced to near zero by using personal protective equipment, PPE. What are the symptoms and signs of Ebola? Feeling feverish, or a measured temperature greater than 100 degrees 0.4 Fahrenheit, that's 100.4 Fahrenheit, or 38 degrees centigrade. Severe headache, muscle pain, weakness, diarrhea, vomiting, abdominal or stomach pain, or unexplained bleeding or bruising. Please note, these could be the symptoms of other diseases and illnesses, not necessarily Ebola. Signs and symptoms may appear anywhere from 2 to 21 days, that's 2 to 21 days after exposure to Ebola, but the average is 8 to 10 days. If someone has gone 21 days and not gotten sick, they do not have Ebola. Is there a vaccine or drug to kill the Ebola virus? No. There is no vaccine against Ebola, and there is no antiviral drug that someone can take to destroy the Ebola virus. Can people recover from Ebola? Yes. While Ebola infection can be fatal, people are able to recover from Ebola. Because there is no drug to destroy the Ebola virus, recovery from Ebola depends on good supportive medical care and the patient's own body to fight it off. However, good supportive medical care can be very effective. In West Africa, where access to health care is a problem, half of Ebola patients die, but half of the Ebola patients live. In the United States, with high-quality, intensive, supportive medical care in hospitals, only 1 of the 9 people that have been treated for Ebola has died. Supportive medical care involves giving the patient intravenous fluids, treating any secondary bacterial infections, and the like. What is the United States doing to prevent Ebola from coming into this country? The Centers for Disease Control and Prevention, the CDC, And the Department of Homeland Security's Customs and Border Patrol now screen all, that is 100% of travelers coming to the United States from the 3 countries that have the current Ebola outbreak. That is Sierra Leone, Liberia, and Guinea. The travelers are interviewed for risk factors, and they are looked at to see if they appear sick, and their temperature is taken. This is done both before they get on the airplane in West Africa and again when they land in the United States. Travelers that report risk for Ebola are not allowed to board the airplane and cannot travel to the United States. Any traveler that becomes sick while en route to the United States will be hospitalized. Any traveler arriving from one of the 3 countries is monitored by state or local health officials for the 21-day incubation period when they arrive at their destination in the United States. In Connecticut, all persons coming into the state from one of the 3 countries gets active public health monitoring. They are all contacted by the local or state health department, working together twice a day to check them for signs or symptoms of illness. This includes checking their temperature with a thermometer to rule out fever, the most common first sign of Ebola illness. All new arrivals to Connecticut have a long, detailed interview with state and local health officials. Some people that have traveled to the affected countries may have their movement restricted or be confined to one location. This is quarantine. The decision to quarantine an individual is decided on a case-by-case basis and depends on several factors like the person's level of risk, how likely they are to comply with public health monitoring, and how the public health monitoring is going. Not many people travel to Connecticut from West Africa. Since the beginning of the screening program, only 18 people have come to Connecticut. Only 6 still need monitoring. The others have gotten through the 21-day monitoring period without signs or symptoms. Therefore, they do not have Ebola. No, we have not had any cases in Connecticut to date. How do I protect myself against Ebola? You are not at risk unless you have recently traveled to an area where there has been an outbreak of Ebola or had direct contact with someone with Ebola. There is very, very low risk of Ebola to the general public in the United States. The same common sense methods that protect against the flu or common illnesses can protect you from Ebola in the extremely unlikely case you are exposed to someone with Ebola. First, wash hands frequently or use an alcohol-based hand sanitizer. Avoid contact with blood and body fluids of any person, especially someone who is sick. Do not handle items that may have come into contact with an infected person's blood or body fluids, including clothing or sheets. If you have been exposed to Ebola, seek medical care right away. If you develop a fever, a temperature of 100 degrees 0.4 Fahrenheit or 38 degrees centigrade or higher, and any of the other following symptoms: severe headache, muscle pain, diarrhea, vomiting, stomach pain, or unexplained bruising or bleeding. What is Connecticut doing to prevent Ebola in our state? Governor Malloy signed an executive order allowing the state's public health commissioner to quarantine a person or group of people exposed to or infected with the Ebola virus if necessary. As I said before, the Connecticut Department of Public Health and local health departments actively monitor the health of any person at risk for Ebola. Anyone who has been in Liberia, Sierra Leone, or Guinea in the past 21 days, or anyone known to have been exposed to a person with Ebola. The Department of Public Health is working with hospitals and the healthcare system to make sure they are ready to detect, protect, and treat patients infected with Ebola. Governor Malloy convened a unified command team of high-level state agency officials to make sure the state works together and the public stays informed. How have Connecticut hospitals and the healthcare system prepared to deal with a real Ebola case, if we have one? The state, along with federal and local agencies, has been preparing to safely care for and treat Ebola since early August. All acute care hospitals in the state completed an Ebola preparedness checklist which includes safety measures for caring for a patient as well as protecting healthcare workers with personal protective equipment. The governor told all hospitals to complete a safety test drill in October, and all hospitals did it. Healthcare workers in hospitals have been receiving regular state health department and CDC updates to be sure that they are ready to respond if we ever get an Ebola case in Connecticut. Which Connecticut hospitals are designated or assigned to care for Ebola patients? At this time, no acute care hospitals in the state are designated or assigned to care for Ebola patients. Any hospital may receive an Ebola patient, and all Connecticut acute care hospitals have taken steps to be prepared should a suspect patient present at their hospital. All hospitals conducted drills to test their ability to identify, isolate, and treat a suspected patient with Ebola. What are the standards for personal protective equipment that should be worn by healthcare providers or first responders? Personal protective equipment, or PPE for short, is important to protect the skin and mucous membranes of people caring for Ebola patients from touching infected blood and body fluids. The CDC has published guidelines on PPE for first responders and healthcare professionals, which can be found on both the CDC's and the state's Ebola websites. PPE for healthcare providers and hospitals that are caring for Ebola patients are more stringent than the PPE recommendations for the outpatient setting. People interacting with persons at risk for Ebola who do not have symptoms and signs of illness and therefore do not pass the virus to others require only the standard PPE used for anyone. Should custodial staff in public facilities take extra precautions in cleaning up body fluids? What are the best cleaning products used for decontamination? The State Health Department has released cleaning and decontamination guidance, which can be found on the state's Ebola website. Where can I get information on Ebola and Ebola preparedness activities? The State of Connecticut Department of Public Health website at www.ct.gov/Ebola, E-B-O-L-A. The CDC website at cdc.gov/VHF/Ebola. Personal protection recommendations are available on the OSHA website at www.osha.gov. 211 info line is another good source for information. That's 211 info line. Thank you for your time and attention.